So now let's see about necrosis. So necrosis is microscopic form of cell death, which is associated with inflammation and which is always pathological. So now let's see. Necrosis is a microscopic form of cell death associated with inflammation and always pathological in nature. Now let's see the types of necrosis. So, types of necrosis. Types of necrosis. So there are 5 types of necrosis which are remembered with the mnemonic CLCFF. So here C is the coagulative necrosis, L is liquefactive necrosis, C is caseous necrosis, F is fat necrosis, and F is fibrinoid necrosis. So let's see first one, that is coagulative necrosis. Coagulative necrosis. So in coagulative necrosis, architectural details of cells are there, but cytoplasmic and nuclear details are lost. So as this is our normal cell which is having this is cytoplasmic detail, this is nuclear detail, this is cytoplasmic detail, and this is architectural detail. But in case of coagulative necrosis, there is only architectural detail present, but the nuclear detail and cytoplasmic detail are lost. So this is the coagulative necrosis. So let's see the mechanism of action of coagulative necrosis. So mechanism of action is the protein coagulation. After mechanism of action, let's see the gross features. So in gross features there is yellow pale area. Well defined pale area is present there in gross feature, but in case of microscopic features we will see the eosinophilic area with maintained architecture. Eosinophilic area with maintained architecture, and there is one appearance known as tombstone appearance of cells. Examples of coagulative necrosis are, so your example are all type of infarcts except brain infarct. So it may be our myocardial infarction. So it is example of coagulative necrosis. Let's see the second type of necrosis. So our second type of necrosis, that is our liquefactive necrosis. Liquefactive necrosis. So in liquefactive necrosis, it is seen in brain infarct. Mechanism of action of liquefactive necrosis is lysosomal enzyme activation. Gross features are pale liquefied area, whereas the microscopic features are eosinophilic lost architecture. Example of liquefactive necrosis is brain infarct. After liquefactive necrosis, let's see our third type, which is our caseous necrosis. So third type, that is caseous necrosis. So in caseous necrosis, gross features: cheese-like yellow areas. Microscopic features: granular variant. An example is tuberculosis. In caseous necrosis, one point is they are remaining in liquefactive necrosis, in caseous necrosis. So in liquefactive necrosis, there is a loss of all, that is cytoplasmic details, nuclear details, and architectural details, both in liquefactive and caseous necrosis. But the difference is there: in caseous necrosis, there are no liquefied centers present, which are present in the liquefactive necrosis. So let's draw a diagram here for liquefactive necrosis. This is normal, and this is nucleus, architectural detail, and cytoplasmic details. But in case of liquefactive necrosis, there is complete lost architecture, liquid is present. So this is liquefactive necrosis. Let's see our fourth type, that is our fibrinoid necrosis. So here, fourth type, that is our fibrinoid necrosis. So this fibrinoid necrosis mostly occurs in the vessel wall. It is also called as vessel wall necrosis. In microscopic features, it is pus positive. And the example of fibrinoid necrosis is the vasculitis or Ashcroft bodies in case of rheumatic heart disease. Then last one, the last type, that is fifth type, is our fat necrosis. So this fat necrosis mostly occurs in the fat rich areas like pancreas. In microscopy, there is chalky white appearance. An example for fat necrosis is pancreatitis. So this was all about the necrosis. If this helped you, then just subscribe to RK Medicos. So this is enough for your university examination.